Hello, for those of you who are new, my name is Whitney and I'm a dental hygienist. And for those of you who are already part of the Teeth Talk community, welcome back. Today we will discuss the 4 main things dental providers are looking for at your routine dental appointments. At the dentist, we perform both a clinical exam and a radiographic exam. The clinical, where we look, and the radiographic, where we take x-rays, work together to give you a proper exam. The first thing we are checking is your gums, also called your gingiva. I'm starting with gums for a reason, before teeth, because unhealthy gums can lead to bone loss. And your bone is what holds your teeth in place. So you could see why this is even more important to me for a routine exam. If nothing's hurting you in your mouth, your teeth are fine, we want to first check your gums and your bone and your surrounding tissue, because if that bone goes somewhere, if you lose bone, your teeth have nothing to hold them in place, and we don't want that. To learn more about gingivitis and gum disease, I've linked a couple videos below of mine that kind of go along with that subject. The second thing we check at your routine dental appointments is, of course, your teeth. We examine your teeth for decay, which can also be called dental caries, or we sometimes just say a cavity. And if decay is sometimes super deep or on a certain area of the tooth, it could cause an infection or a fracture or an abscess. You've heard all these scary terms, but it all starts with checking your teeth for decay, which you need with a clinical and a radiographic exam. By the way, the best way to prevent cavities is to brush your teeth twice a day and clean in between your teeth at least once a day. I will also link my How to Prevent Cavities video in the bottom bar below. The third thing we do is an oral cancer screening. We check for lumps and bumps inside and outside of your mouth, and if something looks suspicious, we will generally take an intraoral photo of the lesion in question and send it to an oral surgeon for a review, or in some cases, we will directly refer you to see the oral surgeon yourself. And lastly, number 4, we check your jaw and your occlusion, which means how you bite. As for your jaw, pro tip, everyone has a TMJ. It's just the shortened name for a temporomandibular joint, TMJ. Lots of people say, I have TMJ, like it's a bad thing. It's only a bad thing if you have TMJ pain. Just a helpful tip, so you'll sound super educated when you go to the dentist. When you don't go, I have TMJ, you have to say, I have TMJ pain. Helping you out. Anyway, unfortunately, a lot of people do have TMJ pain. Sometimes the dentist might recommend a night guard to wear when you sleep, or if it's super bad, we might recommend you visit a specialist. Of course, there are lots of other things we check that stem from these 4 main concepts: gums, teeth, oral cancer screening, jaw occlusion, such as orthodontics, tooth replacement, cosmetic dentistry. But I just thought this would be a helpful overview on the main things we are checking for during your routine dental appointments. Thank you all for watching. I'll see you all next week on #Teeth Talk Tuesday. Until then, peace, love, and teeth.